This is House File 390. And the motion is to lay it over for possible inclusion in the omnibus in the Human Services Finance and Policy Bill. So this is an appropriation. So that's why members, for our new members, that's why we can lay bills over and create a larger finance bill for this committee as we get our budget targets. So that's going to be the motion. Representative Becker-Finn, to your bill. I don't see any amendments. Do you have any amendments?
Thank you, Madam Chair. No amendments to this one, and do want to thank you and the committee for your latitude in getting the previous bill in even better shape as it moves forward. The most important thing about House File 390 is that we hear from the testifiers. This is so no amendments. It's a relatively small grant to Minnesota One Stop for Communities. They're a nonprofit that provides parent mentoring, guidance, and support for parents who are navigating the child welfare system. And they serve parents in several different counties throughout the state. And with that, I would like to give as much time as we can to my testifiers.
Thank you, Representative Becker-Finn. So moving to your list of testifiers, we have the first testifier is October Allen, St. Louis County ICWA Parent Mentor Coordinator. October Allen, please, welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Thank you, Madam Chair. My name is October Allen. I am an ICWA parent mentor that lives and works in Duluth, Minnesota. I have had just the honor and opportunity to work alongside parents that have been affected by the child welfare system. And I wanted to share a little bit of the benefits that parents have in having a parent mentor. What we do is we walk alongside them and help them navigate through their court-ordered case plans and de-escalating a lot of that fear that comes along with working with systems. We empower them to live healthy lives, make better decisions and choices for their children. We mediate a lot of conversations between social workers, attorneys, other providers into establishing next steps into reunification with their children. I've had just an amazing time in witnessing to the impact that healthy families and healthy families that have been reunified make in communities. And I believe that without the help of organizations like Minnesota One Stop, families would not be able to have the awesome experience of testifying to the fact that there is hope and that there is positive change in our systems that are making a difference. And when we talk about better outcomes, I believe that it is the best outcome that peer-to-peer services are utilized in mentoring and modeling different ways for positive change. So that's what I have.
Thank you for your testimony. The next testifier on our list is Jetan Lajoie. If you are here, welcome to the committee, and please introduce yourself for the record and then proceed.
Good morning, Madam Chair. My name is Jetan Lajoie, and I am, I am a parent mentor with Minnesota One Stop, and I have been for a few years. This program has been beneficial in so many ways, just as a professional, being able to just kind of highlighting what Ms. October said, to be alongside our parents for the duration of their cases with child welfare and child protection. So sometimes that can be 6 months, sometimes that can be a year and more. I specifically focus on working with parents with substance abuse issues as well as October. And for those who don't know, the child welfare system is on a very stringent timeline. And when you're dealing with families with addictions, that timeline doesn't make sense to them. So it's really imperative that we get the opportunity to help them understand, encourage, empower them to really push through that cycle of addiction because they are trying to meet so many deadlines and so many timelines and follow case plans and try to understand language in these petitions and courtroom proceedings that's just not friendly to the common language. As well as Minnesota One Stop, we get the opportunity to provide so many different educational resources. We do parenting education classes that is culturally specific and culturally targeted towards the general community and population that child protection serves. And Minnesota One Stop gets to take those parents and really take them under our wings and really understand them and empathize with them and get on their levels. And we've seen a lot of success with reunification of our families in our communities, and that's been important. I've watched how it benefits the parents is I've watched the parents just go from despair to hope to change. And it's a real delight to see, and we stay connected with our parents. So it's not just a program where once you're done and you finished your child protection case that you are kind of off our radar. We follow up, we get together. Before the pandemic, we would get together and, celebrate them, celebrate their accomplishments, make sure that they stay connected to resources. And so I've really got to witness and benefit from seeing the joy of our families stay together and stay committed and stay dedicated. And as well as if they fail once, this isn't a program where they're just cast to the side. They can come through it again. And they can walk with us again. We don't, I've yet to come across a family that we've turned away, even in the situations where it seems like it's not possible, it's never going to happen. We're still with them and we're still partnering with them. So that's all I have to say.
Thank you for your testimony. We have one more testifier on the list, and that is Larene Randle-Wade, CEO of Minnesota One Stop for Communities. Please welcome to the committee, and please introduce yourself for the record and proceed.
Thank you. Good morning, Madam Chair and committee members. 2 years went by so fast. It seems like it was just 2 years ago that we were testifying in this same space around Minnesota One Stop for Communities and our parent mentor program. Since the appropriation, the University of Minnesota, Dr. Wendy Haight and her team was able to conduct an evaluation, parent mentoring relationships as a vehicle for reducing racial disparities. The experiences of child welfare involved parents, mentors, and professionals. And that evaluation, it expressed how important it is for parents to have someone to walk alongside them to help them navigate the child protection system. As mentioned before, it's a very scary process in the beginning, and parents don't know what to do. And so that evaluation proved itself to be very informational and helpful in building this evidence-based track for having parent mentors with parents. I'm straight to the fact. Our numbers over the last 2 years have been excellent. We have seen 85 children returned home since this started. And we had Ramsey County, Hennepin County, St. Louis County, and Carlton County. Over half of the children in the number 85, 14 of them were American Indian, and 34 of them were African American. We would like to, with continued funding, be able to continue in Hennepin County and continue in St. Louis County. We'd like to begin to open up in Dakota County and Anoka County and expanding, we're focusing on where there are high numbers of out-of-home placement. And we get calls all the time, but we don't have parent mentors in the particular regions, but we're able to help. At the same time, we're able to help them to be able to connect with some sort of parent mentor. And while we're helping them connect with a parent mentor, we, at the same time, just do phone consultation with them. But we can only do that. So we can only do so much of that. We would like to focus on rural counties as well with some sort of crisis mobile team of something, because folks in like Rice County and Blue Earth, we get calls from there too. They don't have the help that they need. Ramsey County has seen the benefit of having parent mentors in their county, and they partnered with us with a contract to specifically work with African-American families. And so this particular funding allowed us to continue to work with all others in Ramsey County as well. And so I just wanted to thank Representative Becker-Finn for bringing this back. And we want to do a great work in the state of Minnesota and helping parents and helping the disparities to be reduced, and with hopes building relationship with counties, and they may see the benefit of this, that they may decide that they want to find some sort of appropriation of funding somewhere. And with that, I want to thank you. I appreciate it.
Well, thank you for that testimony. And members, I just want to highlight that, and maybe Representative Becker-Finn can also discuss this, how this would address the Select Committee's recommendations on racial justice. I think it does address out-of-home placement, and the mentoring program sounds like it's been a success. So I just have a few questions for the bill author, and then I'll open it up to other members. But Representative Becker-Finn, can you just discuss what the appropriations have been in the past, the funding mechanisms for this organization, and what you're asking for in the bill and where that money will go, and if there's any reporting or information we can get on the success of the program to date? Thank you.
Thank you, Chair Schultz. And so this was, as mentioned by Ms. Wade, so 2 years ago, Chair Moran carried this bill. I believe I would have to go back and look at my notes as far as what the amount was. Ms. Wade may be able to answer that question on the specific amount, but there isn't a reporting requirement in the language I have here, but certainly I see Ms. Wade is ready to answer your question more fully.
Thank you. Ms. Wade, please proceed.
Yes, ma'am. Thank you. There was a total of $300,000 for the 2 years, so $150 each year. And the reporting requirements that DHS requires, we do monthly reporting because we do monthly billing. So they have an account of our monthly reporting. We put it together as a team effort. What we ask certain questions, we answer certain questions. That's on this reporting sheet that talks about how many were mentored during that month. Were there any successes? Did you make any relationships with other jurisdictions, and questions like that to kind of form a report on the progress of what we're doing. And at the end of the year in December, I kind of gave them a finalized report that says these are all the numbers, all the trial home visits, the out-of-home placements, TPRs. With that being said, I don't like TPRs at all. I don't like termination of parental rights at all. And we had 4. That's a very small number, but it's still hurtful to the heart. So I hope that answers the question.
It does. Thank you, Ms. Wade. We appreciate that response. And I'm going to go to questions now. Representative Sandell.
Thank you, Madam Chair, and Ms. Allen, Ms. LaJoy, and Ms. Wade. I admire your work and want to give it a lot of support. I do have a couple of questions about the organization, however, and how we might be supportive in other ways. in addition to the state grants, where else has your funding come from?
Representative
Yes,
Sandell, Ms. Wade,
sorry.
please answer that question. Go ahead. I believe it was directed to you, Ms. Wade.
I'm sorry, I apologize for jumping. The funding is very diversified. So we have this particular state grant, we have county funding, we have fee for service because we do housing as well. So it's a reimbursement service. We provide the service and we bill for it, and the funds come back to us. We have some private foundations like St. Paul Foundation, Bigelow, Mardag. We have in the past been funded by like Casey Family Programs. They carried us for 5 years while we were in the pilot phase. And so it's a very diversified kind of funding.
Thank you, Ms. Wade. Representative Sandell, do you have any follow-up questions?
Madam Chair and Ms. Wade, yes, just a couple quickly. Are the mentors, the services are really terrific, and the testimonies by Ms. Allen and Ms. LaJoy were really moving. But are the mentors employees or are they volunteers? And how many are there?
Ms. Wade?
Sorry, I keep doing that. There are 8 total, and they're a mixture. So if you are full-time at 40 hours, you are an employee. All parent mentors that are hired start out at 10 hours a week because we want to know, can they do the work? We're really hands-on with them in training. We just don't throw them in the fire and put them with a family. We kind of really train them up and help them understand all of this language of court language, of child protection language, and then they're expected to carry 5 cases. If they can carry 5 cases and do that very well, then the hours will increase and then they turn into an employee.
Thank you, Ms. Wade. Representative Sandell?
Just one more. Thank you, Madam Chair and Ms. Wade. I think the services sound terrific, and knowing what it takes sometimes to get through state agencies, that kind of help is just great and reassuring. But I wonder if what your relationship has been with DHS and how you talk with them about making the process through the agency a little easier to understand and move through. And the other thing is, I hope that you'll be able to extend your services out into other counties as well. That's all.
Thank you, Representative Sandell. Did you want to comment on that, Ms. Wade?
Yes, ma'am. Thank you. I believe our relationship with DHS is a good relationship. They didn't understand us 2 years ago, but they now have more of an understanding of how we work and who we are. They're very close in touch with us, and as we are with them, and learning this process and how it goes, because they didn't have a proposal, they didn't have anything. They just knew we were coming in. So we were able to lay it out and have many face-to-face meetings before COVID to figure out who we were and how we were going to work in the community and with the community. So I hope that answers your question.
Thank you, Ms. Wade.
Thank you.
Representative Albright.
Thank you, Madam Chair. And the questions, I have 3, are directed to Representative Becker-Finn. Representative Becker-Finn, was this proposal presented to the Child Protection Task Force?
Representative Becker-Finn.
I don't have an answer to that question, but it looks like Ms. Wade might have an answer to that question.
Ms. Wade.
Yes, ma'am. Representative Albright, I was one of the individuals that sat on the task force for child protection when it happened a few years back, a little over 5 years ago, I believe. And so they were aware because I was working as a parent mentor in the piloted program in the law clinic for William Mitchell, their child protection clinic. So this has been around for quite some time. And it has carried, and we have walked this journey out to get to where we are right now.
Thank you, Ms. Wade. Representative Albright.
Thank you, Madam Chair. Representative Becker-Finn, in deference to this proposal, would it not be also advantageous to utilize some of the regional training centers? So all areas of the state have access to these services?
Representative Becker-Finn.
Thank you, Madam Chair. You know, what I hear the testifier saying is that they're trying to move forward with this. I think one of the important things about what this organization does is that they are community-based, and it's not necessarily coming from a different direction. And I think to what the chair mentioned before that I didn't actually answer, as far as how this impacts some of the things that were in the select committee report. We have a history in our state and nation of disproportionately separating children from their families who come from whether it's Indigenous families or African-American families. And one of the great things about this organization is that it is community-based and community supported. And so I think it's a both and scenario where we can be lifting up and providing services to different folks throughout the state in many different ways. And what I hear Ms. Wade saying is that they would like to expand further to provide more to our rural communities.
Thank you, Representative Becker-Finn. And I just want to add to that is that I think this organization, it has the trust of families and parents. And I think that is really important if you look at the research in public health. That trust is hard to gain. And if you have it, they can be much more effective. Representative Albright.
Thank you, Madam Chair. An additional question would be for either the Representative Becker-Finn or for Ms. Wade, but we have guardian ad litem that also serve this constituency as well. Could you compare and contrast, just from a financial perspective, the guardian ad litems are woefully underfunded currently, and they serve a great purpose for this demographic as well on a personal level. So I'm wondering what the benefit is to increase the funding or establish an ongoing appropriation from the general fund for this program, as opposed to taking a hard look at increasing the funding for an existing program through the guardian ad litem process.
Representative Becker-Finn.
Thank you, Madam Chair. Well, first, I want to make clear that a guardian ad litem's role is to represent the interests of the child, whereas this program is providing support to the parents. And what we know is that for families to move forward, and if we want families to stay together, which we know is in the long term is the best thing for families, if we can do that safely for kids, we need to be funding both things, because if we had guardian ad litems, talking about things from the point of view of the children and representing their interests, we need the parents to be supported too, so they can take care of those kids. So I don't think it's, again, it's one of those things where ideally we do both things, and it doesn't need to be a zero-sum game.
Thank you, Representative Becker-Finn. Representative Albert, I'm going to go to the other two members who have questions, and then we'll circle back to you if we have more time. Representative Robbins.
Thank you, Madam Chair. Thank you, Chair Becker-Finn, for bringing this bill forward, and thank you to your testifiers. It was very great. Ms. Wade, I had a question for you because it was referenced about the Racial Disparities Committee recommendations. And one of the things I found concerning when we heard that testimony last week was that one of the recommendations was to make reporting of substance abuse in families discretionary. And I'm still very troubled by that. So I wonder, Ms. Wade, if you would support that and what your experience has been about helping parents navigate that, because you referenced that you do a lot of work with parents on substance abuse. Given we just, passed a mandatory reporting bill for all people involved in club sports and club chess leagues and all these other things, it's concerning me we're going the opposite way on substance abuse. So I just wondered if you could address that for me. Thank you.
Ms. Wade?
Yes, ma'am. Thank you, Representative Robbins. If I heard you correctly, you want to know what my take is on and whether it should be discretionary or not?
Yes, ma'am.
Because we work with lots of families, that is sometimes the main focus is chemical dependency abuse on some level or another. Once it's in the system, discretionary, how discretionary can we be, right? It's up to, I think it should be up to the parent as well as the system to kind of work together in regards to what that should be, because they have to go through treatment, they have to work the steps in order to be reunified with their children. That's part of their case plan. I can't say I swing one way or the other as a former addict, right? How, I can live in the shoes that, I can be in the shoes that another person is in. I think once the county finds out that I have a usage issue, once I'm in treatment, how discretionary is discretionary? Like, how much do we use?
Representative Robbins.
That's rhetorical. I'm sorry. It's like I really don't have a definitive.
Thank you, Madam Chair, and thank you, Ms. Wade. So because of your own experience, it sounds like, and I'm asking you, was it helpful that somehow your situation was reported, so you got the help you need, so you experienced reunification? So was the reporting helpful? However your personal story was reported, or did you self-report?
Ms. Wade?
For me, it's self-report. And I've worked with parents that self-report. Some parents, they may not self-report and it may not be reported, and they find a natural pathway, or they end up going to treatment themselves. It just depends on the situation. But we as mentors, our organization is really good with helping parents decide on whether they want to self-report if it's not already found out. If it's already found out, then there's nothing that can do about it.
But your organization wouldn't be required to report substance abuse, and you don't think that's necessary?
We are required as working with counties, right? When we first started working with the child protection system in the law college, we weren't required to report anything because it was as if we were members of the legal team. Now that we have this state funding as well as working with the county, our mentors are expected to report anything that they see. However, there is a process in it. They know we have steps in our policies on what should be done and how it should be done. And one is calling the line, right, to ask a hypothetical question. And having a conversation with that parent to say, what do you want to do about this? Because we've had parents that have dirty urinalysis tests and nobody knows yet, but eventually somebody's going to find out. So if we find out about it, we do, with that parent, walk with them through the process of self-reporting unless it's found out some other way, and then it's damage control.
Representative Robbins, I believe, sorry, Ms. Wade, I didn't mean to interrupt. Please proceed.
Okay. I don't have I don't swing one way or the other. If it's reported, it's reported. If it can be self-reported, then there's dignity in integrity in self-reporting. The other way is feels kind of shameful.
Thank you.
And I believe, Representative Robbins, we can discuss that recommendation at another time. But I believe that recommendation is much more narrow. And I think it's Representative Morrison's bill from last year about physicians as mandatory reporters for pregnant patients. So we can discuss that in another committee. I'm going to let Representative Becker-Finn answer your question. I believe that's why her hand is raised. Go ahead, Representative Becker-Finn.
Thank you, Madam Chair, and just kind of want to refocus, although Ms. Wade is certainly an expert and has a lot of experience in this realm, this bill is really just about continuing to fund this program that has a lot of really great benefits. And also, Madam Chair, I'm very sorry, but I need to sign off to get to a funeral. And so I thank you for hearing the bill, and certainly Ms. Wade can answer many questions. Or I can be available if folks want to reach out to me later with additional questions. I am open to that as well.
Thank you, Representative Becker-Finn, for bringing your bills to our committee. We appreciate it. Representative Rasmussen.
Thank you, Madam Chair. My question was actually for the bill author, but I can follow up with her offline. I was just curious as to what her thoughts were on including reporting requirements in her bill and why she decided to leave them out, or her thoughts on that. But I can follow up with her offline. Thank you, Madam Chair.
Thank you, Representative Rasmussen. And this is an appropriation for an organization. So we often sometimes try to leave an appropriation like this for an organization to leave anything policy that could be controversial, that could stop the appropriation if we believe it's a good thing to fund. But we can talk, yes, please have those conversations with Representative Becker-Finn offline. I'm not seeing any other questions from members. Representative Albright, did you have an additional question?
No, Madam Chair, but I would like to reiterate what Representative Rasmussen just said. Despite, the encouragement of organizations to do good work, I think it's incumbent upon us, particularly because there is an appropriation in this bill, that the taxpayers, I think, are due, not from just a punitive standpoint and a regulatory, a hard fiscal standpoint, to know what's going on in terms of the organization, but in some cases to appreciate the good work that is being done by those organizations and how beneficial that appropriation is. So I would share Representative Rasmussen's desire to have Representative Becker-Finn include the standardized reporting requirements as well. I don't think that it would be deleterious for the organization to provide that, and I think it would also provide people with an opportunity to see the transparency that we operate in, as well as show and showcase the good works for organizations such as One Stop.
I think Representative Albright, I understood Representative Rasmussen's question to talk about mandatory reporting of maltreatment or abuse, or he may want to clarify whether he meant reporting on the results of the funding or the effectiveness of the program. When you want to clarify that, Representative Rasmussen?
Thank you, Madam Chair, and my apologies for not being clear in my question. I was referring to just making sure that we got reporting back on how the money was spent and any performance metrics on how successful the programming was. I very much appreciate learning about Minnesota One Stop for communities today, and appreciate their work. But that was my question.
Thank you, Representative Rasmussen. And we do have something called Results First, where we look at and evaluate our programs that we fund in terms of their effectiveness and benefits. I see Representative Chair Liebling had her hand up. Chair Liebling.
Well, thank you, Madam Chair. And I think you kind of cleared it up there. I was just going to say, I know Representative Rasmussen is new to the process and so on, but the fact that somebody doesn't solve all problems in their bill is not a reason for them not to solve some problems or not to deal with some aspects. So, but if the question was about reporting for this particular thing, I think I heard Ms. Wade say that within the Department of Health, there is reporting going on. And so anyway, I just wanted to clear that up. Sometimes we hear a bill that has a really limited scope, and it does raise other issues. And of course, other members can always bring another bill if they want to deal with another piece of the problem. So anyway, just wanted to throw that in, but I think you pretty much cleared up yourself, Madam Chair. Thank you.
Thank you, Representative Liebling. I don't see any other hands. So the action is to lay this bill over for possible inclusion into our Human Services Finance Omnibus Bill. We don't need to vote on that action.